Spinal stenosis. What can you do for that? Some of the newer interventional techniques.
Yeah, unfortunately, it's something that affects millions of Americans, particularly as we get into our 60s and 70s and 80s. There are numerous treatments for that range from do nothing and let the patient end up in a wheeled walker.
Now, what is it, by the way? What is spinal
stenosis is basically just where you get degenerative changes in the spine over decades. This didn't happen yesterday in typical patient. And it causes compression of either the spinal cord or the nerve in your lower lumbar spine that go out into your lower extremities. And what this does, it causes pain, causes numbness, and ultimately causes weakness in the lower extremities so you can't walk.
Okay, so how is it typically treated and how do you do it?
So historically, we've treated it with open decompression, sometimes with big placement of big rods and screws into the spine, removal of the structures that became degenerated, and instead we put hardware in there.
Okay.
That's kind of the common way that we treat it, or removing bone. In the last 10 years, we've undergone a renaissance in medicine. You know, I'm sure patients have heard of minimally invasive surgery. Well, we have almost percutaneous, meaning just very small little incisions, procedures that we can offer patients now that are done in a same-day surgery center or hospital with same-day, in and out. That usually takes less than an hour. And so there are two in particular that I utilize that are relatively new, meaning about a decade old.
Okay.
One of them is a minimally invasive laminectomy, and we go in with a very small little instrument, and I just shave off some of those very arthritic structures or swollen structures that are causing compression of the spinal cord or in reality down in lumbar spine nerve roots, okay? So that's one way we can do it. Another way, and I think we talked about this earlier, you've got the shopping cart patient. They
lean forward to get out of pain.
You see them in the grocery store or at Lowe's or Home Depot and they're bent over. Well, that's your body's natural response to compression in the lumbar spine. And when you bend over, you actually alleviate that compression.
Okay.
So we have a small device, it's titanium, that I can make a very small incision and I can put it between the vertebral bodies and it opens up that space. And so it's a natural.
Is that right?
Yeah, so it naturally decompresses the spine and puts you in a more forward position.
And how long could that last?
Indefinitely.
Is that right?
Yes.